just happened to mention to Julie one day that, my knee really, really ached, and I said, I don't really think I'm ready to have anything done about it. And then she really said, well, I think you should have something done. And she arranged for me to see Mr. Walsh.
Today we delivered our 100th day case knee replacement surgery. The journey probably started, I think, when I started about 10 years ago. And I think, at the time, the length of stay was about 3.8 days. And then we got to a stage where all of our patients were going home on day one. And it was like, well, why not get them home on the same day?
Well, I didn't know anything about day cases, to be honest. And when I went to see Mr. Walsh, he told me what they could do and the different things they could do. I'm 77, I'm getting older. Why wait?
All the cases we have done so far, we have not seen any complications. Their post-operative recovery is much faster. Patients are ahead in terms of their recovery and outcome at least by 2 to 3 weeks, an immediate 3 months period time.
They wouldn't get anything else in hospital that we couldn't give them with the right preparation to take home with them. So it's about us all then advocate the benefits of it.
Previously there was a mentality in hospitals that you're in for a few days, whereas now the kind of mentality is if you're safe to be discharged, then you're better at home to be able to continue recovery.
The majority of patients have the potential to go home. We've made it the norm. So when we see a patient in outpatients, when the patient goes to the physio and when they go to the pre-assessment, everyone speaks the same language.
The team at BMI Huddersfield, theatre, ward, physio, pre-assessment, we all work very well together. If there was one piece missing, I wouldn't have been able to deliver such fantastic pathway.
That day there, everything clicked in, they all just seemed to like a jigsaw, fit in with each other. And I just went with it. It all happened. No, I do feel proud to be on it, and I think I'm very lucky to be part of it. But it's like a dream, actually. And Mr. Walsh said to me, I've done my bit, Caroline, it's up to you now.